This is the second in my series of 7 short videos about zero harm. In the first video I described how harm can be caused by various degrees of negligence, and I outlined the packages of changes that I call zero harm healthcare, which would enable healthcare staff to standardise patient safety efforts and to deploy a set of zero harm behaviours. I define an error in healthcare as any unintended deviation from the optimum or planned care or treatment. That is, an error may be because something is done which should not have been done, or because of a failure to do something that should have been done. An error is also the execution of a planned act which falls short of the standard required to avoid hazards to the patient. If we can free healthcare from harm, can we free it from errors? We're told that we will, sadly, make errors because we're humans. But of course, not all errors will cause actual harm. We can call them near misses, and we should report and learn from them as well. Of course, as humans, we all do die, but we hope it won't be in a hospital where the care and treatment are negligent, resulting in an early, unnecessarily painful or entirely avoidable death. Hospital treatment is risky though. As a member of the public, I'm constantly surprised, pleasantly of course, by the range of illnesses which can be healed and the extent of trauma which can be repaired. But a lot of that treatment comes with inherent hazards of inflicting further damage during the treatment itself. Giving patients powerful drugs or opening them up and doing surgery carry multiple hazards with a higher probability of serious harm. And we humans react and respond to all of this in our own way, so the unexpected should always be expected. This is why getting to zero harm is a challenge which needs the highest standards of professionalism plus a good deal of support from some essential systems. In the Zero Harm Hospital, the entire staff, medics, managers, administrators, everyone, see their own vested interests directly connected with the safety of their patients, not in their own convenience, so that there's no risk of harm to a patient. So the first fundamental is actually a behavioural one. In the Zero Harm Hospital, the staff are all well rehearsed and practised in a system of defences against errors. The defences, first of all, minimise the risk of error, but they also enable staff to act speedily, professionally and effectively if errors do occur. So the right steps can be taken to prevent harm to the patient. As I said, it's now widely accepted that errors probably can't be eliminated entirely. So that's why I don't say zero error healthcare. Understanding why humans make errors, predicting and preventing them, managing their consequences so that they don't necessarily lead to harm, has now become a science in itself. Zero harm healthcare brings that science, safety science, in an easily usable way to the front line of healthcare to help staff reduce and manage errors. When organisations and staff have done everything they reasonably can to eliminate errors and to manage those they find that they can't, so that there's no question of negligence, the outcome of an error that does happen is not harm, in my opinion. So we can achieve zero harm healthcare. And it's important to differentiate harm which results from negligent or unprofessional behaviour from the unintended consequences of an error made when there is no question of negligence. Zero harm switches the focus from regulators looking for healthcare failures long after they've happened to healthcare staff themselves preventing failures in the first place, delivering right first time. That's a fundamental switch to self-regulation as the primary protector of patient safety. In the third video, I'll explain more about the changes we must make to make zero harm right first time a reality.